So if you're coming in and don't know what I'm playing, this is called Mbira, and it comes from Zimbabwe. Here in the West, they like to call it the thumb piano. All right, thank you.
Yeah.
That was a song called Nemam Sasa from Zimbabwe. And it talks about people, fallen heroes. And earlier, Almas was talking about George Floyd and the impact he had on the world. And so this was dedicated to him. And it talks about how we have to constantly remember people who fight for the right causes and for the just causes. So yeah, that was Nemam Sasa. And I think I'm still good on time, right?
Yes, yes.
Okay. So my next song comes from South Africa. The song was from Zimbabwe. It was in Shona. This next song is called Pata Pata. So I don't know if people are familiar with my idol, Miriam Makeba. She was I consider her the godmother of African music. So if you know the song, please feel free to join me. And the song is called Pata Pata. Sagukubaza chipega. Wasagukubaza chipega. Wasagukubaza chipega. Nancy pata pata sagukubaza chipega. Wasagukubaza chipega. Nancy pata pata sagukubaza chipega. Yo mama, yo mama. Yo mama, yo mama. Yo mama, yo mama. Yo mama, yo mama. Wasagukubaza chipega. Wasagukubaza chipega. Yeah, wasagukubaza chipega. Nancy pata pata sagukubaza chipega. Yeah, wasagukubaza chipega. Nancy pata pata sagukubaza chipega. Yo mama, yo mama. Yo mama, yo mama. Well, this is a song that they do down in Johannesburg. When every Friday, Saturday, Sunday, Monday or Tuesday, when the song comes on play, everybody gets down to the sound of Pata Pata. Yo mama, yo mama. Yo mama, yo mama. Yo mama, yo mama. Yo mama, yo mama. Touch, touch, touch. Pata pata, touch, touch, touch. Pata pata, touch, touch, touch. Pata pata.
Great job.
Thank you.
Thank you. Thank you.
Thank you.
We still have one more.
We still have one more? Okay.
Yes,
I have
thank
one
you.
more for you. All right.
Yes.
I'll do a song that comes from Tanzania. Or some people like to claim that it comes from Kenya. And it's called Malaika. And it's in Swahili.
Yeah.
Yes, and it's in Swahili. So if you know it, feel free to sing along. I can see some of you, but not everybody. Malaika, nakupenda malaika. Malaika, nakupenda malaika. Namenifanyeje kijana mwenzio, nakindwa na mali sina we, ningekuoa malaika. Shindwa na mali sina we, ningekuoa malaika. Esa Tatsumbua roho yangu. Esa Tatsumbua roho yangu. Namenifanyeje kijana mwenzio, nashindwa na mali sina we, ningekuoa malaika. Nashindwa na mali sina we, ningekuoa malaika. Kideke, kuwaza kideke. Kideke, kuwaza kideke. Namenifanyeje kijana mwenzio, nashindwa na mali sina we, ningekuoa malaika. Nashindwa na mali sina we, ningekuoa malaika. Malaika, nakupenda malaika. Malaika, nakupenda Yena malaika namanifa yetu Itanam wendiyopo Nasimbana malisi nawe Ningekuwa wa malaika Nasimbana malisi nawe Ningekuwa wa malaika. That's Malaika, my angel. Thank you.
Thank you. Thank you so much, Piwei. Thank you for starting us this morning. What a beautiful way to begin the day. It's a special day. So we celebrate Africa. We remember Mr. Floyd. And we ask all of you to help us nominate someone to be a part of the Accelerating Black Leadership and Entrepreneurship, a new program of ADN. I don't know how else to deal with challenges and opportunities in life, but one way we do at ADN is when we are aware of the challenge our people face, whether it's in Africa or the communities in which we live, we try to work with all of you. We try to figure out what can we do. And we now have a program that is tailored to help really address the inequity in access to resources for Black entrepreneurs. So we have a very, very good opportunity that we want people to use this as a call to action, because we cannot just talk our way out. We have to do something. And this is one way we can really get people together. So Piwei, thank you for helping us remember Mr. Floyd, celebrate Africa, and again, really share this announcement with our community, which is now open. The application is open. We look forward to receiving from our own contemporary diaspora, people like me who came to the US as immigrants, and our historical diasporans like Mr. Floyd, who gave their life so I can have this life. So I think it's something to be humble and to be present for what we have and what we could give back to others who may not have it, but just at least to be a resource and a conduit to make things possible for our community. So thank you. Our performers are part of our ADN and family, and we're so grateful that you were here with us. Thank you so much.
Thank you for having me.
Thank you. Thank you. Good morning, everyone. Good afternoon to those of you who are joining us from around the world. I am Almaz Negash with the African Diaspora Network. It was Megan who has been pretty much running the ADN virtual events for the past almost a year now, since July. So we're very grateful for Megan for being a partner with me, because we've been doing this with a very small resource, but I'm very happy to say too that we have an additional person that we've hired. So we now have 3 full-time persons, and then a bunch of wonderful human beings that are contractors with ADN that make what you're seeing today possible, and all the programs. So really happy to have all of you. We are based in Santa Clara County in California, and we do hope that you would continue to be a part of our community. Megan, as we go forward throughout the morning, she will share resources. But this morning is about investing in our people, investing in healthcare. And that investment requires that we actually figure out how do we work with people who have resources and knowledge and access to resources that can be shared to our community. And I started this conversation with Diane Dutch about a year ago, when they said, yeah, we would like to be a part of what you're doing, and we also would like to support financially. And so I said, well, then we should really figure out how to curate a session that will bring people who are interested in the healthcare sector to be a part of the conversation. While I was having that conversation with Diane, I was also having a conversation with a wonderful friend of mine, Nancy. Nancy has educated me a lot about the importance of investing in grassroots. It's one thing to be as a diaspora situated in Silicon Valley, try to figure out what can be done in Africa, but it's another thing to be an investor in these kind of communities and really seeing firsthand the challenge grassroots organizations have. And so Nancy has been not only just educating me, but I think also advocating, and she will talk to you about that. So we're very, very happy that you would listen to what they have to say. And I'm also happy to have Dan and Rebecca, who will talk about what that means to really do what they do. And then how can we, those of us who are probably capable and are in the healthcare sector, be a part of their journey and support them as possible. And when I say support, I don't mean that you give money. What I mean is be there for them as a sounding board, as a mentor, as a conduit to resources that they may not have. I also encourage you to use the chat as a way to connect with each other. We have no other way to do it. And, in the normal time, we will do this in person and you will be able to exchange cards. But I would encourage you to use the chat to share who you are, what you do, and then probably if there is something that resonates with you, please connect with the speakers, either individually through chat or collectively. The lessons we learn will be very helpful to all of us. I wanted to also give a shout out to Genentech. Genentech is our current lead healthcare related programs sponsor, or funder, I should say, is funder, not sponsor. We have 4 strategic areas: education, healthcare, connectivity, and finance. In each of these sectors, we bring some of the major corporations to be a part of it, and we're very happy and proud to have Genentech as part of the effort. Plus, we have a Genentech person on our board, so I want to shout out to NDA for making this possible. It always helps someone to have be your spokesperson. So we do have a wonderful person that has made this possible. I wanted to just share again, Diane, thank you for being a partner. Thank you for that conversation we had, the work that you're doing in Kenya, in remote areas in Kenya, and your vision for what can be done. It was very inspiring to me, and I would leave this for you so you can introduce the speakers and the work you do. Thank you.
Thank you, Almaz, and it's just great to be here. And I really, really believe in what you're doing, and that the solutions that we all are seeking are in coming together and being together and working as humanity together. And I just really appreciate you and your leadership here. And I want to wish everyone a happy Africa Day. It's amazing that it happens to be this day. And as we do this work here in the United States, making things more equitable for all people, we are today focusing on how do we support grassroots health organizations in Africa that have been shouldering a lot of the work with very little resources, and yet they are the most trusted, close to the community that we have. And so I just want to dedicate this session to them everywhere, those frontline workers who through COVID in all different places throughout the continent who have been caring, making things work, figuring out things for their local communities. And I hope whatever trajectory you are on right now, if you are a grassroots organization yourself, or a friend of one, or a founder, or a corporate group, or an entrepreneur, that you will join in this discussion, and we'll think of how can we critically support the community-based health organizations in Africa. So let me just start by introducing myself, and then we are going to introduce our great panelists. I just want to mention that I am with the Teba Foundation. I'm honored to be the executive director. Teba is a US-based nonprofit, and we partner with community health organizations in rural Kenya. So we provide long-term, unrestricted, and also targeted funding. And yet our organizational partners are self-sustaining for the majority of what they do. So we're just supporting them. We supply also volunteers and expertise and connections. We recently met with the Harvard Business School and the Community Partners, and they're a great organization. They have helped us look at a couple things that our organizations, our partners, brought to us. They said, we want you to look at a future where we do more telemedicine. where we do more social entrepreneurial businesses that would also support healthcare. And so we've gone through that, and we're really excited about that. And we'll be introducing you to our partner from Mati Babu Hospital in a few minutes. But let's start with 1-minute introductions from each partner here. And I would love to first introduce you to Rebecca Stevens from Novartis. So welcome, Rebecca, and thank you for being part of this today.
Thanks so much, Diane. And I'm very happy to be part of this meeting today, especially in Africa Day. As you can see, my clothing really attests to this. So I'm Rebecca Stevens. I'm from Sierra Leone. I'm based in Geneva, Switzerland, and I work for Novartis. The work that I do at Novartis is really, I broker global health partnerships. So it's working with local organizations on the ground in sub-Saharan Africa to make sure that we can bring healthcare, affordable healthcare to patients in communities. So that's really the crux of my work. And I'm very much convinced that the local partnerships are what makes things work, because the local partnerships are what enables us to really reach patients where they are. So very happy to be a part of this event today, and I'm looking forward to a really exciting discussion.
Thank you so much, Rebecca. And let's hear from Dan Ogola, the CEO of Mati Babu Hospital. Welcome, Dan. Dan, you're muted, I think. There you go.
Happy African Day with African Diaspora Network. Dan Ogola is my name, and I'm the founder and executive director for Mati Babu Foundation, an implementing grassroots healthcare organization in Western Kenya. Our hospital and School of Nursing provide services to the rural community in Western Kenya, with about 1 million population, and we provide our services to about 30,000 people annually with outpatient, inpatient, and pharmacy, laboratory, and even surgical intervention. Our community health workers focus on women and children health, people with disability, cervical cancer, and we are currently piloting telehealth. It's a pleasure to be with you today, the day for Africans. Happy African Day with the African Diaspora Network. Thank you.
Thank you so much, Dan. Welcome. And Nancy Reynolds from Health Builders.
Hi, everyone. My name is Nancy Reynolds. I'm here as both a funder and a fundee. So in my role as the chair of Health Builders, I am a fundee, and I'm able to see from a different viewpoint what the local organizations go through on the ground. And hopefully we'll have a chance to discuss many challenges. And as a funder, I realize some of the conversations I hear in philanthropic groups I belong to, where some of the sources may come from of concern for funders, and also lack of knowledge. So really excited about this conversation, and many, many thanks to Almaz and Megan and Diane for offering this opportunity, and happy African Day to all. I can't think of a more meaningful day to have this conversation that's critically needed. Thank you.
Thank you, Nancy. Welcome, everyone. Let's get into the conversation. You know, there is a notice that went out about this meeting today that talked about what's actually originated with this 1090 principle. It was adopted by the Global Forum of Health Research that highlighted that of less than 10% of worldwide resources that are devoted to health research were put towards developing countries, where over 90% of all preventable deaths occur. So there's a real inequitable funding process that has been going on for years. And yet a lot of people say, despite these findings and the disparity of the incurable diseases throughout developing countries, especially in Africa, a lot of these medicines are available to treat, the conditions like diarrhea and malaria. They're available, but the issue is not necessarily with the medicine. It's the ability of the affected to access it. So health services can be inhibited by lots of circumstances: poverty, local availability, stigma and cultural practices, inadequate healthcare systems and infrastructure. So many investors are realizing that grassroots healthcare organizations and health training organizations, if supported, could be the key to reversing these outcomes. And unfortunately, many people are beginning this. We're going to hear from one company today, talk about that shift, but still only about 1% of international health funding goes to community health organizations. So we're here today to discuss how do we amplify the voices of these small community health organizations and how do we support them? So I would like to start with, we're going to discuss the first question we want to look at is like, what are the challenges and what are some of the solutions that we're looking at? So let's go back to Nancy first and hear some of your overall thoughts about the whole sector. Thank you.
Thank you, Diane, and thank you for pointing those pivotal facts out. I think what struck me most when I became involved in supporting international health in East Africa was the disparity and inequities that I always thought were in the provision of healthcare in East Africa was the problem. So my passion is supporting nurses, and especially female nurses in these environments who provide most of the healthcare. 90% of the healthcare in East Africa is provided by nurses in rural settings with very, very few resources. But I realized the inequities went way deeper than that and were structural and had to do with the chronic lack of funding for these community-based organizations and the continued support of large international NGOs who are often white-led, often out of the States, and have enormous budgets as compared to local community-based organizations. Then when I look deeper into it, if you look at the outcome measurements of the very large INGOs who absorb the majority of funds in international health versus the outcome measurements of local community-based organizations on the ground in East Africa, there is no correlation. The local community-based organizations' metrics and outcomes are so strong and impactful. So when I started looking at that and then the disparity with the funding, I thought it was quite shocking. And I think, you know, for me, watching, so I'll speak about health builders, but it's not just health builders, it's all the community-based organizations go through this. They're strangled for funding. They're kept small. They are small because they're kept small by the lack of funding. Their potential, the opportunity here, I think, is that we have no idea what the potential is to change healthcare in East Africa, but people on the ground think it's absolutely enormous. The people that are running these community-based organizations are from the communities. They know the solutions. They're proximate to the issues. They culturally obviously understand deeply what's going on, and yet they are muzzled as well because when you behind closed doors, and I've had the great good fortune to be involved in Rwanda for over 10 years, and then other NGOs in other countries in East Africa. Behind closed doors, when I've asked local NGO leaders, what do you think of international NGOs' work? This one person, these were the exact words. There's no legacy, there's no continuity. It doesn't even matter if they were here or not. When they leave, and they will leave at the end of their 3-year, 5-year grant cycles, mostly from USAID, so does their work leave. It doesn't matter. They don't even need to come here. And I think, especially in view of USAID, who has the bulk of funding for healthcare in East Africa, to continue on with the model they have of funding these corporate-like international NGOs who are not having the results and also are top down. So they come with their solutions and impose them. There's very little input from local communities. It's a travesty. And I think it needs to be named now. When I've asked local leaders, have you talked to USAID? They've said, no. And some have said to me, please don't bring this up, because then we could be put on a blacklist. Whether that blacklist exists or not, I don't know. But the very fact that they're muzzled, their voices are muzzled, their funding is strangled, and a lot of them just wither. So I think there's huge opportunity here. And I think there are organizations out there who are leading the way, including Siegel Family Foundation is a very large foundation that only works with community-based organizations. And if they can do it, USAID and bilateral should be able to do it, I think. And there's African Visionary Fund and New England International Donors. So maybe we can talk more about that later. Sorry to be going on. And I think Almaz had a line that I'll never forget. Thank you, Almaz. We can't talk our way out of this. I think that's what we've been doing for the past decade or two, trying to talk our way out of it with no change. So thank you for that line on us. Thank you.
Well, thank you so much, Nancy. Let's what you mentioned about the landscape is real, and I'm glad we have Dan Ogola here with us, who is a leader of a community-based organization who lives in this daily. And Dan, would you shed some light as an implementing organization? What are some of the challenges that you face? And we're talking about access to capital. We're talking about, we started with the deepest conversation, the money part, and then we're going to go to the voice, right? But as far as what are the challenges and what are some solutions that you see?
Thank you so much, Diane, and thank you, Nancy, for highlighting very important facts. Some of the challenges that we see as we run the grassroots healthcare organization as follows. One is getting connected to a potential investor is a nightmare. The other challenge is, as Nancy, you mentioned, the process of application and evaluation is so complex that it never targets the grassroots healthcare organizations. And if you are successful and you get the funding, most of the funding are vertical, specific project, they are project-based. And so, and for a short duration, so you are targeting, for instance, HIV. And if a woman has a cancer of the cervix, that's not important regardless of the correlation. The other challenge is power dynamics. The people who are providing the finances are the ones who define what success is, regardless of the local definition of what success is. And as you have mentioned, at times once they have defined the success and the project is over, be it those projects funded by the big donors, it's for a short period of time, and when they go, they go. Yeah, so those are some of the main challenges we face as implementing grassroots healthcare organization. Accessibility to the donors, the verticality of the funding, and also lack of connectedness, because healthcare is a wholesome thing. Thank you.
Thank you, thank you. And so Rebecca, we're really excited to have you here because Novartis started back in 2015, I think it was, kind of leading what I think is a slow growing movement of corporations and foundations who really get it, that this needs to be more of a grassroots funded strategy. So tell us what you think from your position and where you sit.
Mm-hmm. Yeah, so it's just really interesting, just reflecting on what Nancy has shared and what Daniel has shared. So I started working in a corporate responsibility program in Novartis, the Malaria Initiative, in 2007. And at the time, it was really interesting because what I observed was we would have meetings with some of these super huge NGOs. They would come to visit us in Basel. There'd be a whole show and dance that would go on, and they would come in and court us to really fund these huge programs. And as an industry, you know, pharma has often been on at least in terms of reputation, it hasn't always been easy. So I realized that a few of our leaders were really flattered when we had all these NGOs come in and do all the song and dance and tell us, you know, what about a big, you know, collaboration with us? And so we, you know, we went along and we did these big, you know, partnerships. But then when I went to the ground, when I went to the field, I realized that these organizations were working with faith-based local community organizations, local faith-based organizations. And I was like, what's going on? You know, we were under the impression that they were doing the work themselves on the ground. And we realized that they were not. They were actually working with the community organizations that Daniel is referring to. So that was in 2007. But it took a while to really convince my colleagues at Novartis that we, instead of, you know, always working with these big organizations, that we should just go directly to the field, directly to countries and work with these local organizations. So in 2015, when we launched Novartis Access, which was really about managing chronic conditions. And the big difference, because before with malaria, you have malaria, you take a few pills and then you feel better. But with chronic conditions, what we saw is that we had to put people on treatment and make sure that they stayed in treatment for the rest of their lives. So the whole model was very different from just having an NGO come in and do like a 2-year program. We needed to have partners that were able to be in these countries for very, very long periods of time. So I went in and started working with faith-based organizations in Kenya. We worked with the Christian Health Association of Kenya and KCCB, another faith-based organization. But then again, I faced a number of challenges internally because my organization said, but why are you working with faith-based organizations on the ground? Why are we using religion to get to patients? And then again, we had this whole education that took place where I was saying, but these are the organizations that actually get to patients. If we want to make a difference, we have to work with these organizations. They have been there forever. They have been dispensing healthcare forever. These are the partners that we need to have on the ground. And around the same time, I met with Nancy at Health Builders, and I was just uber impressed by what Health Builders was doing in Rwanda. And I think one thing that particularly struck me was how integrated they were in the communities and how they worked hand in hand with ministries of health. So I set up this challenge, and that was really bringing all of my colleagues in global health to understand that community-based organizations were the way to go in terms of making an impact in many of these countries. And finally, I would say that after a lot of, education, taking my colleagues to the ground, we've gotten to a place at Novartis where we really realized that that's how we're going to make a difference. Because what we're aiming to do is to increase patient reach in sub-Saharan Africa. And I think we're pretty clear now that we're only going to be able to do that by working with community organizations on the ground. And in terms of what Nancy also referred to, in terms of impact, and this is what an organization we worked with in Cameroon on non-communicable diseases, I was just blown away by the impact that they had and the numbers of patients that they were able to, basically, they screened patients in the community and they were really managing chronic conditions, hypertension in these patients. And it was just incredible. We were having numbers of like 80% impact in the community. And we had never seen, ever in my career, had never seen such great impact. So it's been a journey, but I think that we've come to a place where we realize that whatever we're doing in these countries, we need to work with community-based organizations because that is where the impact lies. And that is where we reach patients and we can make a difference. So the whole, I would call it the PR piece, I think we're sort of beginning to realize that there are partners that can actually deliver and there are others that, a lot of talk, and they can't deliver the same results. But I don't want to say anything that's going to get me into trouble, but I think it's just been a personal learning, but it's also been a learning for my organization that we need to have these community-based organizations and we need to work hand in hand with them whenever we want to make a difference in countries.
Rebecca, thank you. That was a beautiful outline of, why should a corporation make this shift? And thank you for your advocacy. I want to clone you and put you all over the world. There is, I do believe that there are more and more people seeing this. And I think what's happening in the United States, what has happened with George Floyd and the whole kind of awareness is letting us know that we need to work with the grassroots. I think what you're mentioning too is that these large organizations, international funds that receive some of these funds, a lot of it does not actually trickle down to those small organizations. And so there's actually a lot of cost efficiency as well. So thank you so much for what you shared. I will ask you when you come around again, do you think this is a growing movement? I have noticed even with our organization, the Figs Scrub Company recently told us, and it's a women-led company, it's doing great. And they said, we want to have deeper work. And so they are giving Teba and Matibabu 50,000 scrubs, medical scrubs, to hand out throughout the whole country, but through a chain of partnerships in the grassroots, along with the Ministry of Health folks. And so it's more guaranteed to actually get to the people who need that support. And because they chose to do it through a grassroots organization, that trust helps us with that pipeline. So I think Dan will be talking about that, but I think as small grassroots organizations join together in collectives, they're more likely to be heard. And so I really encourage those of you that are on the line, if you're part of a collaborative that you would like to bring attention to, put your information in the chat and let's hear, where are you located? If you're a collaborative or an association of grassroots. But let's talk specifically about some solutions and hearing voice. And so, Dan, I want to start with you because you have outlined like 4 or 5 things that you think could really support with dignity community organizations. So, Dan Ogola.
Thank you so much, Diane. Yes, there are many funders and partners who wants to support people at the grassroots level. But I know there could be some better solutions to provide them with the platform to do that. Some of the suggested solutions are coming up with the Grassroots Change Lab. And the Grassroots Change Lab is to provide a space that welcomes people from grassroots movements, as Diane has said, pulling together makes our voices be heard. Civil society, entrepreneurs, and funders to meet and make connections. Then within this incubator, sessions to investigate problems and co-create solutions, provide business models, training and collaboration on funding and resourcing, because that's a major challenge to grassroots entities like us. The other suggested solution would be to come up with an unbranded basket fund, just like the African Visionary Fund, to encourage every foundation to consider small unrestricted funding to frontline groups for multiple years. It is a great way to do a deeper study of impact on the local communities. The third suggested solution to the challenge we are facing is to come up with a trademark for funders that show that they are implementing partners. They are actually local implementing partners, because some of the INGO morph themselves to be local entities and they end up getting the funding. And so create a system to recognize organizations that truly empower grassroots organization through their philanthropy. Finally, come up with online resourcing together with other grassroots organizations. I'm aware that SIGAL and African Visionary Funds are doing this. Thank you.
Thank you, Dan. Those are great. I think he actually, maybe Megan, you can put in the chat, he put a chart together with these 4 ideas, which I think are being tested in various places. And let's go to Nancy. What are you thinking about solutions?
Thank you, Diane. When you said, do you think this is a growing movement? I think it is a growing movement, and I think we need to make it grow faster. So through all of our voices coming together and what Dan's mentioning, I think there's huge opportunity right now. And again, through Siegel Family Foundation and others, the African Visionary Fund. As far as the tactical improvements and the ways I think could bring enormous change, there's one that sounds so simple, but I truly believe if funders went to NGOs and said, what do you need? And what's on your bucket list, they could direct so clearly and accurately what needs to be done in their locales, rather than having foreign-led NGOs, large NGOs, go in and tell them what the solution will be. So I think that's number one, for funders just to ask what you need. And to Rebecca's point, I think, in our conversations with Novartis, if everyone could have the conversation Novartis is willing to have, they basically ask, what do you need and how can you get this done? And they'll tell you what their needs are. If they could be used as the role model for bringing funding to local CBOs, I think would be a huge help. Simplifying the application process would be enormous. And again, I'm thinking of USAID, and to Dan's point, the process is so overwhelming for a USAID and other bilaterals applications that these small teams on the ground from the local community-based organizations, the same person who's the executive director may be the same person writing the grant applications, doing the finances, maybe running the programs. They're tiny teams doing all of this. They're actually in competition, in front-facing competition with international and NGOs who have enormous departments researching grants and writing grants and have lots of volunteers from universities, from the public writing grant proposals. So simplifying the process and really making it about the donor, not about what the funder is looking for. And as Dan said as well, what are the measurements of success? There's other things that need to be taken into account that are qualitative and community-based and culturally sensitive that need to be thought more about, I think. Design programs with a bottom-up approach, again, asking the local organizations what they need. They can also tell you the best program to implement. And that was the biggest lesson I learned at Health Builders in particular, was going from an expat-led organization where it was mostly top-down to locally led has been the steepest learning curve I've ever gone through. I mean, the metrics are vastly improved. The conversation and communication between the Ministry of Health and Health Builders is on a totally different level. And we walk in lockstep with them, and the metrics just keep improving and improving, and new programs implemented. Unrestricted funding would be huge for locally community-based organizations. The restricted funding that funders have tended towards in the last maybe decade, where it's program specific, really hamstrings organizations. They need the overhead because they know the programs they need to run. And if people are trusting enough to fund an organization, then we should trust enough that they will know what the solutions are, rather than us delineating the programs and mandating programs to them. So unrestricted funding, and again, Siegel does only unrestricted funding. So Siegel is just a massively strong role model as well for this. Shift the power of the bilaterals. I think that it really needs to be focused on. Until that power shifts, we're going to have a hard time moving the needle. Capacity building and knowledge sharing. And it's not that I am advocating that all the large funding, and in some of these grants, like USAID gave a $48.5 million US grant to an INGO in Rwanda for health system strengthening. No local NGOs were included in this. And, I think capacity building needs to be done. So I'm not advocating for a grant that size, which is too huge anyways. It's not needed for the work that needs to be done, can be done cost effectively by community-based organizations. But to the capacity building, it's not that the local NGOs think that they can do it all. This is my impression. They know, but put them in charge, and then they can go, if they need help with financing or budgeting, or business plan, then they can go, if they want to find an INGO and resource some of the funds to them just for some contract work, that's fine. But I really do think it needs to be turned around so the local NGOs are in charge, and community-based organizations, and they can bring in who they know, what they need to know in capacity building measures. And then lastly, of course, Dan, you probably know it'll never be the last thing I'll say, but one of the last things is the media. I think this needs a lot more in the media. I think it needs speaking out, because as far as Americans, I think we assume that our taxpayer dollars are going in part towards foreign aid, and it goes to USAID. But what happens on the ground is nothing what I think the typical American is assuming happens with their money. It's very far from it. Less than 1% of foreign aid, including USAID dollars, go to local-based organizations. And I actually think most Americans would be shocked if they found out that INGOs are absorbing the bulk of the monies. So I think media campaigns and more public awareness will help this movement as well. Thank you.
Well, thank you, Nancy. It's interesting to hear both you and Dan talk, because the ideas really overlap. Like, this just shows this is what is actually happening. And I love, Dan, what you said about, actually, it could be part of the media campaign, is, you know, having some kind of rating system for corporations that they adopt. Just like if you build a sustainable building, you get a different color star, or you do fair trade. You know, if you're actually working with the local communities that you say you are serving, we need to recognize that and pull those out. I had a major INGO a conversation where they talked to me, and this was a year and a half ago. They said, pretty soon it's going to shift, and you actually, you know, they'll come to grassroots collaboratives and ask them what they need, and then they will come and find a research organization to do some of that. So I was amazed, but I haven't seen it happen yet as far as those really big groups yet. But Rebecca, I'm interested to know what you think as far as solutions, and also, do you think this is a movement that people are beginning to have awareness about, and how can we help bring that awareness and attention?
So I definitely think it's a movement. I definitely think that, you know, just in the space of a year, I've seen a lot of, you know, companies sort of start thinking about how do we make impact, and, you know, we should make sure that, you know, the communities that we work with are actually the communities that we want to impact are the communities that we work with directly. So in terms of some of the solutions, you know, you talked about a collective, and I think a collective would be really important. Sort of a collective of community-based organizations that really, what I call, survey the landscape, like do a survey of the landscape. Because when you look at programs like the one Novartis launched, the Novartis Access program, there was a lot of press around that. There was really a lot of press. And we were asking for NGOs and organizations to come to us. And of course, the ones that did come to us were the big INGOs. But it would have been interesting at that time to also get, you know, to get sort of like interest from some of these community-based organizations. So I think probably just having, not doing it every day, but just surveying the landscape, the donor landscape, to see who is investing in what would be a really good idea for the community-based organizations to do. I think it's a really important piece, because at the end of the day, it's a competition. That's the way I see it. And these large INGOs have this really large share of voice. And just speaking from experience, I even see that they go to the World Economic Forum in Davos. They're present there, so they're always in front of corporations, because they have this seamless PR, this machine that just keeps on, you know, throwing information in our faces. So I think surveying that landscape is really, really important. Another thing that I would say is I think that community-based organizations have huge advantages. First of all, in terms of cost, because when I look at some of the proposals that have come my way, you know, proposals where, you know, organizations are asking us for millions and millions of dollars. And then, you know, I reach out to a community-based organization, and they're like, and they basically say, we can do this amount of work for this amount of money. And it's not that we're trying to save money, but it's just when you have money to invest, you want to reach as many patients as possible. So, you know, community-based organizations have this in their favor, is that they are able to do, you know, interventions at a really cost-effective price. And I think that needs to be sort of highlighted when these organizations speak to corporations or to donors. I think it's really, really important to sort of say that $1 US is going to go a really long way if you're investing in a community-based organization. And it's not because we think that people should be paid less. I just think that the way they manage, they're very resourceful in the way they implement their projects. So it just makes, you can really stretch that dollar a really, really long way. Another thing that I think is really good is this data, because we all want data. We want to be able to measure impact, and we want to have data. So I think community-based organizations should actually, you know, sell that more, or profile the fact that they have this data. They can actually show a Novartis, for example, if you invest $1 here, this is how it's going to impact someone in the community. And I think that community-based organizations can do that a lot better and a lot stronger than some of these big INGOs. So I think really, really tapping into that data and really looking at, you know, it is something that it's an asset that should be sold a lot more than it is today, from my perspective. And then media, but in a different sense, sharing your success, because I think that a lot of organizations are very humble, so they'll do all this great work, but no one knows about it. So maybe investing in the communication side of things to really show, hey, this is what we're doing. These are the patients that we've reached. And I know it's sometimes difficult to get into some of the peer-reviewed journals, but I think just being present in these type of journals would really go a long way. So that whole visibility and activities, I think, is really, really important. I think at the end of the day, and I don't want to be too commercial, but I think it's gonna really rely on how can community-based organizations put themselves out there and really show what they do to the world. Because if you look at the Global Fund is working with a number of faith-based organizations in Africa as we speak. And how did they get there? Because they realized that those organizations delivered really good impact. So community-based organizations should really do a lot more of that publicity side. And I know that budgets are really tight, but I think it would really be worth their while to really show and share the data and the impact that they have, because I think that is really going to attract a lot of funding from foundations and corporations, because we want to go where organizations can deliver impact.
Mm-hmm. Thank you so much, Rebecca. And what you just said, we want to go where organizations can communicate impact, where they can share what they've done. I think that's really important. And there might be, as we move to this next question, which is, how can the diaspora get involved in supporting and amplifying the voices of community health organizations? There are lots of people I know in this organization that are entrepreneurs, they're connected to communications. That is one area that I think you really put out, and even data and analytics, teaching and sharing those processes. It's a big investment on a small organization to do those things, but I think most that are growing are doing that. So let's kind of do a rapid response here to this question about how can the community of the diaspora get involved with amplifying the voices and the power of community health organizations. And let's start with Nancy, then we'll go to Rebecca and then Dan, just real quickly all the way through, please.
Okay, I promise, Diane, I will. I think the number one thing would be what Rebecca just said, trying to get the word out there about the work of the diaspora doing this for the local NGOs. So just the diaspora, I think, will be pivotal and really crucial in trying to move the needle on this and having local CBOs supported. I would plead with the diaspora just to find out what local CBOs in their country of origin are there doing work in silence almost. As Rebecca said, they're too small to get the word out there. So if the diaspora can help them, join boards, join these local community-based organization boards would be huge. That would be probably the biggest thing. To open up connections, to do some knowledge sharing. Health Builders, as an example, has a very active board that works often with the team, and it's just this wonderful, positive relationship. There's great respect for the team on the ground, and their accomplishments are well recognized. Being on these boards can be really exciting, and you're actually causing change in the communities through the local teams. So I'd advocate joining boards if possible. Please, diaspora, feel free to contact African Visionary Fund. It's a powerful group that's now being formed specifically to support these community-based organizations. They've got great material and guidance on how to do this. Siegel Family Foundation as well. And there's another group, New England International Donors, a group of donors who are looking to support grassroots organizations. All of these, I think. And then also, if you are in touch with an NGO in your country of origin, to ask that local NGO, who are other local NGOs, they know. So if you ask any one of them who are impactful, and most of them are, the local community-based organizations, ask them who else is working in this country, who's causing great impact, and who's effective. And it's a very good resource for finding out, finding ideas of who to support. Thank you.
And Rebecca, go ahead.
Yeah, as Nancy said, building on that, we all have social media platforms these days. And I think it's really about leveraging those platforms, everything that we have, to really talk about the work that community-based organizations are doing. I think the diaspora has a lot of weight, because and we are in boardrooms around the world. So it's really using our personal networks, using our social media networks to really get the message out and to really, advocate for community-based organizations. Again, I think that with data, with impact, with the impact data that we have, we can actually even make a stronger case to saying, why don't you work with a community-based organization in Rwanda, in Kenya, in Ethiopia, for example? So it's really going out there and using our networks to really, move the needle and advance the cause. I think that would be really, really critical.
Dan?
Yes, I fully concur with what Nancy and Rebecca are saying. Get the word out there for us, but very importantly, you can also adopt us and introduce us to your community, your network, the donors that are associated with you. The other thing that you can do for us is visit us. When you visit and you see what we do, probably can help you, can make you communicate what we are doing better outside there. You may also, in Kenya, we have a concept, Swahili concept called Harambe, which means pulling together. So we can pull, we can work together to pull funding to support some of our activities. We do know that our friends in diaspora have a lot of networks, and they can help us pull together and support those organizations like us that are in touch with the community. Thank you.
Wow. These are all fantastic ideas of bringing, all of you here are with us today at the Africa Diaspora Network. How can we get involved? And I noticed a couple of the questions in the chat. We have a few minutes. Almaz, do we go ahead and answer those questions, or do you want to?
Oh, yeah. Yes, please.
Okay.
Do answer their questions. There's some really wonderful ones.
Yes, I noticed a couple, and I think we have covered a couple of the questions, but one of them says in particular, you know, how do we actually wean off or look at, how do we break the reliance on USAID, humanitarian aid, and outside stockholder versus stakeholders? And how do we amplify Black voices and the narratives of those mostly directly affected by the problems that we're trying to solve? This is a really good question. I want to ask the question, when we're talking about community-based organizations, I don't know if there is a actual reliance. I think they're always trying to find this funding. I don't know how many community-based organizations are actually getting it. But I welcome the partners here to discuss that. But, you know, how do we make sure that this is centric to African needs and the actual stakeholders? How do we do that? Rebecca, do you want to take that one first?
Yeah, I think it's going to be, it's going to take a little bit of time, but I think that we can actually get there. Just a few years ago, I actually participated in a meeting in Rwanda, which was actually, it was called Friends of the Global Fund Africa. And the objective was to get Rwandan small and medium enterprises to basically fund health in Rwanda. And I remember when we went into this meeting, you know, my colleagues from the Global Fund in Geneva were like, I wonder how much money we're going to raise from this whole thing. And actually, after about the event was presided by His Excellency Kagame, and actually at the end of the evening we had raised over $1 million, and I was really, really impressed. So what that taught me is that we do have organizations in our countries that are actually also willing to fund health. It's, you know, we don't always need to rely on money from some of these large donors. There are organizations, local organizations, that want to do this type of thing. So I think this is going to happen with time. I think that we're going to have to move from, you know, being very reliant on these, you know, big NGOs or these big donors, and moving into maybe getting funded from more regional or maybe even more local enterprises. But at the end of the day, I think what's most important is to make all of these efforts sustainable. And when we talk about community health workers, there's two schools of thought. I hear people say, well, they shouldn't get paid. They should do this on a volunteer basis. And then I hear they should get paid. And I actually think that they should get paid, because if they do get paid, this creates the sustainability, you know, in the system. And I think that's really, really important. So I think looking at maybe different sources of funding, making sure that we build sustainability into whatever it is we do is really basically the next step to sort of like interrupting or stopping this reliance on international funding from my perspective.
Thank you so much, Rebecca. And you bring up the idea of sustainability. And I want to go to Dan next because I know that Matibabu has really focused on being self-reliant. And so I don't know, if a lot of community health organizations are getting these big grants, on a consistent basis. And what are some of the other ways that you are self-sustaining? Dan, I cannot hear you. I think maybe you are muted.
Thank you so much, Diane. Sorry for that. I think within the organization, let me give a good example of Matibabu. Within the community that we serve, there are some assets in there. Like for instance, when Matibabu came up, the land was given by community members. And so there are a lot of asset development, with asset development mindset. There are a lot of things that are resources that we can pull from within the community that can lead to sustainability.
Thank you so much. I know that there's a lot of public-private partnerships with National Health that's helping. And also, I think it'd be great if everyone would, every corporation would adopt a couple. Just take a couple and dig deep with them long-term and give them that unrestricted funding so you can really understand what is happening on the local level. I would encourage that, but I think it is time to give back to Almaz. I want to thank each one of the partners today. It's been a wonderful conversation. I know Oxfam is going to be releasing a lot of information about grassroots health effectiveness in the short term. So I look forward to more discussions soon. Thank you so much.
Thank you, Diane. Oh my goodness. Thank you, Diane, Nancy, Daniel, and Rebecca. What a refreshing conversation. I was writing a lot as you were speaking because there's so many to take in. Although I have to say that we do a very good job at summarizing, giving you the video, the content of the discussion, and definitely the chats, because today there were some really great conversation going back and forth and through the chat. So anyone, the 168 people who registered for this event will get that information, plus also our network as a whole through social media and also through the newsletter. I just want to say thank you to each and every one of you for your insight.